Shocker in West Bengal continues. The number of infant deaths continues to rise to 41. In the last 6 days, as 5 more deaths are being reported from the Burdwan Medical College and Hospital. But now we're getting information that a new unit is going to be inaugurated at the BC Roy Hospital. That's where more than 21 infant baby deaths have taken place. But what we are being told, according to sources, is that this particular unit that is being inaugurated does not have the kind of manpower and doctors that are required to man the unit. So clearly an eyewash that is being conducted by the Mamata Banerjee government, considering the kind of adverse criticism that has come against her particular government. Shambit on the phone line with us. Shambit, we believe that the MOS of Health is going to inaugurate this new unit, but from the details that we are getting at this point, clearly this unit also not completely equipped with the kind of doctors and nurses required. So just an eyewash by the Mamata Banerjee government to try and curb down the criticism.
Exactly, Maruk. In fact, this unit was supposed to come up later in the month of November. But after this series of dates and after this criticism, severe criticism that this Mamata Banerjee government is facing, the inauguration has been advanced today. And it is being done in a very unceremonious way today. Union Health Minister for State, Sudip Bandyopadhyay, will be coming here, inaugurate the new sick newborn care unit out here. But it will have 40 beds, but without any new recruitments. In fact, our sources in the BC Roy Hospital for Children are telling us that at least 22 persons are needed, including the doctors, for a new unit like this to be operational, but that has not been done. So they'll have to manage, quote unquote, manage with the existing facilities and existing staff and doctors. This newborn unit is just coming up as a face saver. That is what it seems now, because the government wants to save their face and say that we have done something, see, with urgency. But how far it will be functional, operational, that's a big question, Mahrukh.
Right, Shambit, stay on with us, because one of the parents of one of the infants who passed away spoke with us and described to us what exactly is happening inside that hospital, where a new unit is now being inaugurated by the State Minister.
মোটামুটি 4 দিন হলো বাচ্চা ঠিকই ছিল গত রাত্রিরে ওর মা দুধ খাই এসেছে 3 বেলা করে দুধ খাইছে কিন্তু দেখা যাচ্ছে সকালবেলা হচ্ছে যে 8টার সময় ম্যাডামরা জানায় যে আমাদের বাচ্চা একটু অসুস্থ ঠিক আছে তারপর খবর নিলাম শুনলাম যে আমাদের বাচ্চা মারা গেছে ট্রিটমেন্টটা যেভাবে হওয়ার দরকার ছিল সেইভাবে হয়নি টাইম হচ্ছে যে কোনো মাসি বা কোনো ম্যাডাম কোনো ডাক্তারবাবুকে কোনো কিছু জিজ্ঞাসা করলে কিছু বলতে চায় না
And Shambit still there with us from outside the BC Roy Hospital. Shambit, what are your sources within the government saying? Now, apart from this very feeble attempt at damage control, where they're opening a new unit at the BC Roy Hospital, why is it that Mamata Banerjee hasn't come out and spoken about this? Because twice she was asked a very categorical, clear question and she said, please don't ask me, I'm not here to answer questions on the infant baby deaths, but kind of shrugged the question off. But is there a certain amount of pressure that the government is feeling at this point?
Exactly, Maruk. In fact, Mamata Banerjee is under severe pressure from within the government and also outside. In fact, she is the health minister and she is not coming out with any good answer. What are you getting to know from our sources in the health department, that she is pressurizing the health department officials to manage the situation as soon as possible and do this damage control. As part of that only, this new unit is coming up. In fact, in last July, when this baby deaths had taken place, then we were told by the Director Medical Education of West Bengal that there will be 20 such sick newborn care units in different district hospitals, and there was original proposal was to open up such units in those hospitals which has 5,000 deliveries a year, but that is not coming up, that has not yet come up. So she is definitely under pressure and she wants to avoid any kind of uncomfortable question, Maruk.